Thank you, Acting Speaker, and I rise to speak on the Aged Care Restrictive Practices Substitute Decision Maker Bill. This is a bill that seeks to establish a framework to explicitly identify and authorise a substitute decision maker in the event of a residential aged care provider requires consent for the use of restrictive practices when a care recipient is in a residential aged care facility and does not have the capacity to provide that consent. Now, whilst I support this bill, I really don't think we give the aged care personnel, the medical staff and the mental health practitioners the tools to manage those who actually are suffering and need to have restraints put in place. Now, despite the promises of this Labor government, the mental health and aged care systems are broken. We have the legislative responsibility and duty of care to all vulnerable members of the community. And from my experience, I think we've lost the balance. Clearly, we should always take responsibility for using chemical or physical constraints on anyone very seriously. However, we also need to give health professionals and families the ability to make decisions and support them. Health professionals tell me how frustrated they are and they feel they can't provide the sufficient duty of care to people in their care because the pendulum has swung too far in favour of clients' rights and away from patient care. Patients are now called clients, and we seem to have lost sight of the duty of care that was once extended to patients. I've personally been dealing with a very difficult situation. The story of my own mother, who is currently in an aged care facility and is not receiving the essential psychiatric care. The individual staff, the carers, the cleaners, everyone are doing a wonderful job. But it's a difficult situation that she's in due to the psychiatric aspect of this. The last 2 years have been a battle. She's suffering from paranoia and psychosis, effectively living in a horror movie in her own imagination, where she believes she's under siege, being attacked, abused and tortured. As part of her care arrangements, I regularly have to sign off on her physical restraints. Due to her behaviour, my mother has been placed in the memory support unit, or as we're calling it here, the dementia unit, but continually manages to leave. Facility staff tell me they are unable to help, and physically, once she's out of the locked unit, as the Aged Care Act prevents them from physically restraining her. On one occasion, Mum escaped from the facility. She didn't tell anyone. She booked herself into a motel room during the night. Her paranoia escalated and she believed she was being attacked and stalked and called for help. The motel owners called the police. When they arrived, she turned on them and refused to cooperate. They didn't want to put her in the police van at 2 a.m. at 92 years of age, so they called me, and when I arrived, she turned on me. That was my first real awareness of how significant Mum's paranoia and psychosis and delirium was. So began many incidents over the next 12 months, and here are a few. My mother has reported my father to the police for abuse. They interview him and deduce that allegations are false. She runs away from family when we take her out on outings, approaches strangers and claims that she's at risk and being abused. The Good Samaritans call the police call me. She gets off to the police station. The police have to do this reporting thing. She rejects advances from family who are trying to help her because of her extreme state of paranoia. The episodes are becoming more and more bizarre. One time, Mum smuggled a screwdriver into the aged care facility. She then went on a rampage with attacking staff as she believed, in her paranoid state, that they were trying to kill her. On another, she took off from the aged care facility and again couldn't be restrained because no one could touch her, stood in the middle of the freeway until police and ambulance somehow coaxed her off. She accused a man who couldn't speak and who had dementia of sexual assault. Quarterly, I continually sign consent, giving the staff the use of restraint, physical restraint. Mum continuously accuses the doctors and staff of drugging her. She accuses the doctors, staff and her family of trying to kill her. I've begged staff to get psychiatric help and treatment for my mother. I've begged them to administer available antipsychotic drugs. My hope is, of course, to get my mother back, the loving woman she once was. There are drugs that could treat my mother's psychosis and paranoia, but because she is treated as a client, she refuses to consent. And the staff tell me they're unable to administer these chemical restraint drugs against her will, as it infringes on her human rights. She's also refusing to take her cardiac medication because she doesn't trust the staff and thinks she's being tricked. So she's putting her physical health and well-being at risk because she thinks it's unsafe. So we're not going to drug her for psychosis, but we're allowing her to not be physically well. It makes no sense. So she's causing this physical damage to herself because staff can't demonstrate a duty of care. The health system is unable to administer essential drugs to my mother without this approval because of her client rights. She's in physical and mental pain and unable to be treated. As a former nurse, I feel like I'm leaving a patient in excruciating pain. I've never walked past a broken leg, for example, without administering support and pethidine, the drugs of choice when you're needing to alleviate someone's pain. But I have to walk past my mother and can do absolutely nothing to alleviate her suffering. As a daughter, I'm at my wit's end and have exhausted every avenue. The nurses tell me they can't touch her when she escapes the facility because of legislation. One day my son had to manhandle his grandmother because nobody else could, a very confronting event for a young man. The police, ambulance, medical staff and nursing staff are all unable to assist. They get called time and time again and have to take all the reports. It's actually an incredible use of resources. They said they're scared that they'll be re-registered or their employment jeopardised. It's obvious my mother is experiencing intense mental pain, brought on by her age. In January this year, after a year of this, I asked for a meeting to try and find a solution. There were 17 health professionals in attendance: psychiatric professionals, the head of the psych unit, nurses, doctors, psychiatrists, health support workers and an elders abuse rights representative. Yep, I did say 17. And the conclusion was, because of legislation, there is nothing that any of them or me or anyone can do to help her. Of course, no one would put that in writing. The circus that has been going on for 2 years, I was recently told my mother is too difficult for the facility to handle. Firstly, they said they would send her to a psychiatric ward where she would be committed. This is yet to happen because my mother has to accept voluntarily to go. Yep, that's the madness of all this. She refuses as she doesn't think there's anything wrong with her. The idea of her going to a geriatric psych unit scares the hell out of me. But my mother's current suffering scares me more. I just want my mother back if that's at all possible, but if it's not, I'd like her to be treated adequately to relieve her suffering. Relieve it. Thank you. I've lost where I'm at. We need to do more. It's as simple as that. And, you know, the health staff do an incredible job, but they're absolutely hamstrung by lack of legislation, by lack of staff, whether it's the aged care facility working in this mental health state or it's a mental health of patients in the mental health system. We just are not doing enough. And I think that story tells the story of many, many families who are frustrated, who can't get the assistance they need. The Royal Commission into Mental Health had so many recommendations, and the fact that we're still taking this levy from the community really to pay for a better system and delivering no better care is an absolute disgrace. I have mothers who recently, one mother told me her son will either be the next Gargasoulis or he'll be dead. He was undiagnosed because they said he was no longer a schizophrenic, and he'd been that since he was 17. At 40, just a month ago, he was found dead in the squalor of his home, which he'd ransackled so many times. These are families that can't tell their stories because they're really hard to tell, and I'm really sorry I got emotional, but they are really hard to tell. And the frustration and the pain and suffering you witness as a family when you have a person who's suddenly in this mental health system and the mental health system can't cope, and the government's saying we will make it better, and they've had recommendations from Royal Commissions and they're not implementing, it's just simply criminal. And when I see the amount of money, I think it's $1 billion in the next budget that this government have put forward, and I see people saying that they need help, and families who approach me time and time again with young children or old people who are not getting any mental health support when they need it. We can change all the legislation we like around restraints and constraints, but when the staff don't have the government backing them in and really using lived experience to make changes, then unfortunately what we're seeing is inaction and a government who is doing nothing.